Hi and welcome back to the channel. My name's Ash, I'm the founder of FutureDoc, and this is a short series that I'm doing for all the 13 key modules that you need to know from my online interview course. And what I'm doing is condensing them all to give you a short 10-minute-ish summary for each of the important topics. Today we're going to be covering professionalism and all the things relating to it that you need to know and give you the bare bones so that you can go away and study what you need to do to make sure that you score well in your medicine interviews. Professionalism is a really important topic because you are given quite a lot of responsibility. Even as a medical student, you will be part of really important parts of people's lives, whether they're good or bad, and you need to show to the medical school when you interview that you can act appropriately in these high stress or high significant situations. And you need to demonstrate to the universities that you can act appropriately in these really important, significant situations of people's lives. So there's a very important document that kind of outlines how we should act from a professionalism point of view as both medical students and as doctors. And it's a very important document that I'm going to ask you to actually go away and read yourselves, which is the GMC Good Medical Practice Guidelines. And those cover 4 broad categories of the responsibilities and duties of a doctor. And those are that it's the doctor's duty to maintain their own knowledge, skills and performance, their safety and quality, their communication, partnership and teamwork, and also their ability to maintain trust with the patient and those around them. So there are some important definitions that come up during these professionalism stations at medicine interviews. So I'm going to go through each one quickly and just give you a quick, succinct definition of each term. So the first one is honesty, which is the ability to tell the truth. Integrity, which means one has strong and honest moral principles. Professionalism, which is what this is all about, and that is the set of standards which a doctor agrees to uphold. Dignity, which is being treated ethically and respectfully. Confidentiality, which is keeping people's information private. And then finally, empathy, which is the ability to relate to other people's feelings. And one of the categories that we touched on earlier are one of the most important, which is maintaining trust. We need society and people to trust doctors generally to be able to get the best out of patients. You can imagine if somebody doesn't trust a doctor, they may not give them the crucial information that they need to get the right diagnosis and then to treat them appropriately. So doctors and the doctor's governing body, which is called the GMC, and I'll talk about later, they both need to ensure that doctors are behaving in an appropriate way to maintain a professional standard and ensure that that trust is upheld within the public eye. Let's talk briefly about the kind of professionalism scenarios that you'll see. So if you are having a panel interview, then of course it will just be a discussion on the subject of professionalism. And then with MMIs, it may be a discussion, it may be a role play, or it may be a ranking exercise similar to the SJT, where you're actually given a scenario and 5 options and you're asked to think out loud and talk with the examiner through how you would rank them in that particular order and why you do so. So typical scenarios that come up are those relating to alcohol or drugs, unprofessional behavior such as maybe theft, mistakes that have led to an adverse outcome, or dishonesty, maybe such as cheating on an exam. So when it's a discussion or role play type scenario, the most important thing for you to do is at the start, when you're reading and you're having that minute to understand and get a flavour of what the scenario is, or the panel are asking you a question, is try and elicit what the skill is that they're trying to get out of you and try and target your answers and formulate them in a way that showcases that you understand the skill and that you can demonstrate it within yourself. And then when it comes to those SJT ranking type questions, there are 4 things that you need to do. First, you need to state what the underlying professionalism issue is. Then you need to start ranking your answers. Then the best thing to do is start with the first one and the last one, and then talk through your rationale for why you order the 3 middle ones in the way that you do. And in these ranking type scenarios, it may very well happen, and it's a good opportunity for the examiner to actually challenge you and challenge your thinking. Now, this is a good test to see how well you handle being challenged and whether you can hold your nerve, have an intelligent conversation, not be rude or get too defensive, and just discuss their opinion versus yours and the pros and cons for each. So definitely one thing is to not be fazed if somebody challenges you. It is part of the exam. Don't get put off by it. And like I say, just follow the advice that I've just given and you will do absolutely fine. So there are really 3 skills that medical schools are testing or looking for when they perform these professionalism type question. And those are: number 1, can you demonstrate the professional attitudes and behaviours that are required for medical school? 2, can you show that you have some knowledge of the GMC and what's involved in the medical career? And 3 is resilience. Like I said, they may challenge you on some of your answers that you give, and it's about how you handle it and how you can respond in a courteous and professional manner. So what is the underlying rationale behind all professionalism? Well, really, one of the most important things that we think about is patient safety, and that is one of the things that you should have at the forefront of your mind when you're answering questions. To read something directly from the GMC, they say you must take prompt action if you think a patient's safety, dignity or comfort has been seriously compromised. So going back to those ranking type scenarios that you might have, anything that involves improving the patient's safety will usually rank the highest. Even as a medical student, it is your duty to put the patient's safety first. And there are certain circumstances under which it is right to raise a concern. So these could be behavioural problems where maybe someone's not showing up to work or being aggressive, not acting in line with the good medical practice guidelines. So that could be anything from breaching confidentiality or maybe bullying. It could be dishonesty, or then it could be something like illegal behaviour such as drugs or alcohol, or maybe the ill health of a colleague. And finally, it really helps to know a bit about the GMC, who they are, what they do, and why we have them there. So I'll quickly read to you a passage from the GMC website that gives a succinct explanation of what they do exactly. We work to protect patient safety and support medical education and practice across the UK. We do this by working with doctors, employers, educators, patients, and other key stakeholders in the UK's healthcare systems. So what does the GMC do? Firstly, it holds the medical register. So that tells you, and you can search online for all the people who are licensed to practice medicine in the UK. They also set the standards for doctors, as we discussed previously in the good practice guidelines. They also are responsible for the training of doctors. They are the people who regulate the standard to which the med schools train people. Also, they take care of people renewing their license. Every 5 years, a doctor has to undergo something called revalidation, where they prove that they're continuing to practice and learn and grow. And finally, the GMC investigates any complaints or concerns. So there we have it. That is the bare bone essentials that you need to know about professionalism when sitting your medicine interviews. Now, of course, these are the real bare essentials. So if you want more, I have an online course where I have over 15 hours of videos, lessons, mock interviews, and model answers that you can look at, as well as the hot topics. And also, just if you're enjoying this video series, please let me know in the comments below, even if it's just yeah, this is great, keep doing them, just to let me know that it's worthwhile and you're enjoying them. And please, if you don't already, I'm going to be releasing these every couple of days, so make sure you hit subscribe and turn on notifications so that you don't miss any. And thank you for watching, and I'll see you in the next video.